Bruce Lee. He's a professor at the City University of New York Graduate School of Public Health and Health Policy. He's joining us live from New York. It's good to have you with us, sir, on Al Jazeera. Niamh was just talking about the slowness of the rollout across the EU. What kind of impact do you think having to pay more for the vaccine is going to have on that rollout in the EU?
Yeah, thanks, Rob, for having me. So one of the issues right now is the focus needs to be on increasing vaccination coverage as quickly as possible to stop the transmission of the virus. And so EU countries need to focus as many resources as possible towards vaccination campaigns, information campaigns, and actual operationalization of the vaccination programs. So to raise the price of the vaccines will further drain those funds and resources and could potentially negatively impact the rollout of the vaccines and increasing the coverage of the vaccines.
As Niamh was mentioning there, it's the consumers in the EU who ultimately are going to end up footing the bill for this. Who do you think is most likely to be hardest hit when it comes to this?
Yeah, one of the big issues is that there needs to be a way of prioritizing lower income neighborhoods, lower income communities to get vaccinated, because they tend to be higher population densities, and therefore many times the virus can more actively spread in those areas. So if you have a situation where people who are can least afford to pay for a vaccine, but at the same time need to be covered as quickly as possible, you might have a difficult situation, because if this cost is being passed along to all the citizens, et cetera, that might really further disadvantage those who are already socioeconomically disadvantaged.
The big pharmaceutical companies certainly the ones who are producing the vaccines, have made a big thing about the fact that they have to pay for research and development. And of course, that is true. But it's also said you get more profits out of controlling a disease than it is about actually curing it. And if the big pharmas know they can get more cash in the long term, does that, do you think, mean that they're going to lose interest in ultimately finding a solution to this problem?
Yeah, we have to keep in mind that we need to look at the long term. I mean, this certainly, the companies deserve credit for helping to develop the vaccines, but the research has been under development for many years across many different types of laboratories. And we have to look at the longer perspective, that we need to control the virus as quickly as possible. And of course, the virus is going to continue to be around, so there will be opportunities to continue to control it going forward. But really, the focus needs to be controlling it now, because that's going to hurt everyone, not just from a clinical standpoint, but also from an economic standpoint.
Dr. Bruce Lee, we appreciate you being with us on Al Jazeera. As always, thank you very much indeed, sir.
All right, thanks, Rob.